Good morning. It's Ruth Ann Norton. I am the current chair of the Maryland Lead Poisoning Prevention Commission, and really welcome everybody here. And I have to say a lot of reflection on this issue as we go into 24 with enough activity happening at every level that's going to touch housing over the next year in our state and in our both urban and rural communities, around the investments that are under the title of climate, those investments under the title of affordable housing. We have a lot of work still to be done, both holistically on healthy housing, but in particular at the base of that, the critical linchpin is lead. I just left a conversation with the New York City Public Housing Authority that has been in scandal for the past decade, really trying to grapple with these issues, and a lot of resources. We have seen a spate of high lead cases in Baltimore in the fall of 23. We're seeing an increasing number of warnings around food sources coming from applesauce and the cinnamon that's in the applesauce and the packaging. And we're seeing a lot of sources coming from not only immigrant communities, but various communities throughout the state. So I'm hopeful as we kick off this year and that we have a tightly defined purpose that respects the many things that people are being asked to take on as we have to get workforce capacity back to scale, and how do we build that capacity throughout the state of Maryland to do this work. But I hope we'll also work together as a commission to actually update the strategic plan for the various stakeholder communities that we have, and have something that is executable, and that we are able through the legislative session to do what is necessary to ensure that the state itself at MDE, at MDH, at DHCD have the resources to be able to do the things that are need to be done, that we are moving the ball more and more and more to prevention. That will be not only through education, but really building a compliant contractor, property owner, and resident populations that know what they need to do in that. And I think if we double down hard here in 24 in this issue, we'll be able to see the light at the end of the tunnel in the next few years to think about how do we better integrate in what we're doing. So most of all, I thank you for being here, and lots of big announcements to be made on things. But also, as many of you know, the organization that I lead has just been tapped by the EPA to lead a $50 million fund to improve environmental justice, equity, and issues like healthy housing throughout Region 3, which includes Maryland, but Pennsylvania, Delaware, Virginia, DC, and West Virginia. The opportunity there is there are organizations across the state who can help us in this effort from a different hat. We'll be looking for those organizations to see where we can help lift and build capacity from Allegheny County over to the Eastern Shore. So hope that will be helpful as we think about that. But at this time, Wendy, if we could, can we just take a quick roll and make sure we have quorum?
Yeah. Excuse me. I think I'm getting feedback. Hold on. Okay, so I think we have a quorum, but there are two people that are on the phone call. I believe they might be Susan Kleinhammer and Anna Davis. Can you please identify one of you are muted, but Susan and Anna, are you there?
I'm here. This is Anna, and I'm 11. The last four digits are 1146.
Okay, thank you.
Yeah, and good morning, Wendy. This is Susan. I'm here. My last four digits are 2680.
Thank you very much. And Barbara Moore, I see you there. Benita Cooper is here. Thea Williams is here, which is our new commissioner.
Welcome, Theo. And
yes.
first of all, I want to commend you for your outreach to learn about the commission and how DHCD can contribute in that effort. So thank you. We look forward to that discussion.
We're very happy to hear and very happy to have Jack Daniel's support on this as well. So thank you all very much.
Thank you.
Cliff Mitchell is here. I just saw you come in. Excuse me. Mangela Paul is here. Paul Rogers is here. Ruth Ann, we see you, of course. Is there anybody else that I did not call as a commissioner that is here? If you could speak now. Adam's going to be a little late.
Nicole Hart, I think, is she the rep for
I'm
Baltimore?
here. I'm
Okay.
actually in the building.
Oh, you're at MDE.
Yes, I'm at the lobby.
Okay. Tyler will handle that. And
Will do.
Nicole, yesterday, MDE put out a request that this be virtual, and I'm sorry that did not get to you. We'll make sure next month we'll be in person, and I appreciate you showing up because I was the one who wanted to have an in-person. So sorry, I'm not even there to greet you for that. But Tyler, if you could maybe have Nicole come to your office or something.
That's what I was gonna plan.
That'd be great. I
I'll be back.
appreciate that. Thank you. All right. Anyone else that we missed on the roll call? I think we do have quorum, Wendy. Is that correct?
Yeah, we do.
Fantastic. So if you could put the agenda up, and I'm going to try to do my very best not to have you talk much, and empathies and sympathies for everybody who's got hit by the bugs that are going around in the world. It's we'd like to be rid of them. Dr. Mitchell, I thought you were going to take care of that, but we're
I
good.
am derelict. I apologize.
Yeah, that's okay. So if you could put up the minutes from the last meeting, we would appreciate that. We've got a relatively light meeting today. And I don't think we have Jacoby Wilson today. We did not hear back from him. I think that we can move that, by the way. But let's do the minutes here. If you have had a chance to read the minutes, any emendations to the minutes, please let us know now. Really do appreciate DHCD, EPA, and MDE's coming into the meeting last month to give us good updates. Appreciate that.
Move to adopt the minutes.
I have an amendation. Wes's last name is Stewart, not Steward, for GHHI down in the notes. If you could make that correction, I would appreciate it. I do want to give an update that yesterday I did meet with Robin Lewis from the Maryland House of Delegates. Delegate Lewis is going to pursue seeing how the House is going to appoint a potential replacement for Delegate Attar, if Delegate Attar wants to step down from that role, and pledged that she would do that. I also want to note that I have Senator Carter, who had said to me verbally that she did not think she could serve further. We have put in a request to Senator Ferguson to reappoint a new person from either JPR or Energy Environment. committee. It's now called the EEE. Anna, you may know better than me what it is. And so we're asking for those appointments to happen. It is the start of session next week on the 10th, I believe. And, but we're hoping to have those. And so if Paula or Tyler can hear me, I want to work with MDE to see if we can get that, that done. Section approval of minutes should be December 7th. So if we can note that as well, Wendy. Any other parties with comments? If not, if we could get a
Move to adopt the minutes?
thank you. A second?
Second.
Great. Okay. So seeing as we don't have Dr. Wilson on the Technical Assistance Centers today, we will work to continue to do that, but I'll just give a little background on this because I think this is pretty critical to start to understand. The University of Maryland and Morgan State University are part of a partnership led by University of Maryland and others for the region, including the National Wildlife Fund. And centers are being set up to provide community-based organization and others the technical resources to advance environmental justice work and work on improving our environment, our health, right? And closing the social determinants of health, or addressing those and closing the racial disparity gap. The technical assistance centers are going to be available to help organizations do grant writing, to receive technical training, and to make referrals where appropriate to receive funding. The Green and Healthy Homes Initiative, as I noted in December, EPA noted that they had awarded us, my organization, the $50 million fund that we will, over the next 3 years, impart grants running from $75,000 up to $350,000 to help build support throughout the region to organizations to deliver services that advance environmental justice, equity, the Justice 40 initiatives out of the federal government, and those things that basically will build capacity. GHHI was chosen in part because we've gone through and are continuing to go through the lift of capacity building, having started with a single person $70,000 budget and learning how to build that capacity in community. What we hope is that the commission here and other commissions in Maryland will pay attention to this and make connections over both to the University of Maryland Technical Assistance Center and to GHHI as we endeavor to build the capacity within the mission of the Moore administration of leaving no one behind. This is a good fit in that. It also will be an opportunity to build a workforce capacity throughout the state on those issues of environmental health and environmental justice. So by no means is the technical assistance centers or the fund going to be dedicated solely to lead or to lead and healthy housing. There will be lots of issues around wastewater, issues around Chesapeake Bay, runoffs, other environmental health issues that I think will be very beneficial in partnership. Our goal for the region and for the state is to be building philanthropic funds that will match these dollars. So we are going to be convening a panel of climate funders with the state to coordinate, to build a fairly robust fund to help organizations, including state agencies, to be able to meet the gaps in funding, because all of this funding, as Nicole Hart or others will know, you get grants and they don't quite cover everything you need, right? So our goal is to try to fill those gaps, right? To align and braid and fill those gaps on this. But, having quick response teams to environmental health issues and housing, including lead, throughout the state. If your child's in Washington County or in Salisbury, we don't have the resources we need to be able to address those issues. So I know that collectively we're going to be wanting to meet with MDE, MDH, DHCD, others to map out needs so that we can target dollars smartly to where they need to go. We also have a real need, and we'll call on this everyone here, to make sure that we're getting robust coordination between the health departments and the housing departments and organizations like GHHI and hopefully others as we build forward and stronger, to get referrals in. So Deputy Commissioner Hart has ARPA money that has to get spent. I'm sure, Nicole, you have a plan on that, but we need the referrals on the citizens to do that. Getting those houses de-leaded, improving the conditions for seniors in many different ways, and the other things that they're spending the ARPA dollars on from the city need to be, we need to help the city in directing where we can ensure that we put Barbara Moore out of business, right? And on to other things. I think, Barbara, I love you, so we'll find you a great job.
No, that's okay. Retirement would look really nice in a few years.
Right? But if we're thinking about childcare too, in this, childcare is often overlooked in terms of the funding that is needed. So how do we direct in that? Theo's and Jack's department has now a mandate to be looking at things from a whole house strategy. There are gaps in that are going to be identified by the Green and Healthy Housing Task Force that they have. So I think it's going to get really important that we do a lot of strategy. So working with Paula and Tyler and the team at MDE, I'm going to want to do a one-on-one with every member of the commission and those in the interested public here about how do we lay these strategies out. And as I have raised also, the concern that I have on the greenhouse gas emission dollars that are going to come into the Maryland Clean Energy Center, to the Calvert Foundation, to the Enterprise organization, community partners, I think they call themselves now. There's going to be a lot of disturbance of lead-based paint as we tear out heating systems and replace new, as we repair roofs, as we put on solar, as we do a lot of different work. The byproduct of that, the unanticipated byproduct, I think, of these programs is the amount of work that's going to be incumbent upon us to ensure that we are not putting more poison in houses and in the air, right? But that we have aligned funding into these projects and that we're able to match that. And coming into this too is going to be the EPA Community Change Grant. And I know there'll be at least one specifically looking at the role of climate, health, and housing, and to be able to build capacity here. So I know we want to be able to make sure that lead, which wasn't funded by the Infrastructure and Jobs Act or the IRA, except for on water, but lead paint and other sources, haven't been addressed by big federal funds. So we need everyone here thinking, and I'd like to have a dialogue around this if we can, about what do you really need? And this includes Wendy, anybody in the public, right, who's here, about what we think is really needed so that we can turn this into strategic actions in support as the community change application goes in, and as we get ready, because the Thriving Communities Grant Fund we will lift and open in April. I'd love to get done and make sure all of that is done as quickly as possible so that people have more time to grow and that we can concentrate our efforts on the match funding work. But also, how do we prepare for those things that are in that Climate Solutions Now Act? This MDE did a really remarkable job of putting out a significant climate plan. Talks about the need to address housing in that. And Tyler, I think I'd love to have MDE come and talk about how it sees issue toxins like lead, right, that have to get addressed as those things happen. How does MDE see that happening? So maybe Cindy Orto from the Buildings Task Force or others can come to a future meeting and talk to us about that. Cliff, you have your hand up.
Thanks, Ruth Ann, and thanks for that summary. So I've been thinking about this a lot because we've been working for several years, as you know, with the Department of Housing and Community Development statewide, looking at the whole referral process for the Medicaid CHIP program. And I do think, and I know I've said this before, but I do think that this group really needs to think long and hard, and I agree with you completely, about how we marry and integrate the issues of equity, resources, and the changing picture of lead across the state. And it's not changing because the lead is changing, but because, especially as we detect more kids with lower levels of lead where it is harder to identify the specific source, and as we look at the practical issues of getting families to commit to and participate in lead abatement activities, we really need to think long and hard about the equity and public health priorities and how it is that we identify properties, housing, and areas to focus on. And I don't think that's a simple question. I think it's a really complicated question because our strategy that is focused on rooting out the same microgram of lead from every child, regardless of where that child is starting and what the potential source is going to be very complicated and very expensive and very time consuming. And we don't have infinite resources in any of those categories. So we really do need to think carefully about a strategy that maximizes equity, public health impact, and the greatest good for the greatest number of kids, but which recognizes the differential impacts of different levels of lead and also different geographic areas where we know there's a lot of lead, but there may not be a lot of children affected. And I don't think any of those are simple questions. And I don't think that the answers are simple. And I don't think that a strategy focused solely on referrals from families that have been affected is going to be the strategy that is the most effective necessarily in all cases. So I would just like to second your comments about the fact that for the state needs to be thoughtful about this. It needs some help in terms of thinking about alternative strategies and the cost and effectiveness of each of those strategies. And it might be helpful to consider getting some help from some academic institutions and experts and having some people come in to talk to us about what those strategies could look like, because I don't think that this is a simple question.
Yeah, and I think about having how we have to play a part in a strategy that is practical and helpful. And I hate to like call on Theo and Nicole as I look at the screen. You just happen to be right in front of me. But I think about like, yeah, there probably certainly I can. I'm gonna, kind of channel Nicole for a minute, but yes, we need a strategy, but the practical needs of every day to execute are like deep, right? People, contractors, how we build it, etc. So as we think about doing a strategic plan, I would, a couple of years ago, we offered GHHI. We had a great team of folks in our organization put together an asset and gap analysis plan. But we have to be able to do who's executing that, how are we executing it? And as we think about strategy today, I can't offer the same resources, say, hey, we'll just take it on and we'll do that. But I want to make sure, Cliff, that we're not so academic that it isn't practical and it isn't swift.
No, and I agree.
You know what I mean? Because things
I
are
agree with
happening
you.
now that we need to support Tyler and the MDE team, and we need to support Theo and Jack.
Yep.
Right? We've got to support Angela in real ways. So I think we need a really swift, practical action plan that is imbued with strategy. Right?
So I don't disagree with you. The only thing I would add to it is that it might be helpful to think about an evaluation along the way so that we can look at the results and titrate them as we move forward.
No doubt. I think that's right. I think we can try to put a panel together of academics, if you'll work with me over the next month and get people here to think about doing that. I also, we have in this state with almost little or I see very little the other big organizations in the country that are thinking about lead, and I never see them on the Maryland scene. And we've got to get them to think about Maryland. And then a new one was just launched this week by Tom Neltner from the Environmental Defense Fund, who has departed EDF and wants to look at those sort of things in food and spices and other areas, right? Necessary to think about a strategy from an advocacy standpoint. But my caution to him too was it can't be academic and tell us only what's wrong, but we got to come up with the solutions, right? Many of those will be federal policy solutions there. But I do think we do not have enough home visiting in the state that is proactively looking at this issue, connecting back. We've got to really strengthen that side of it. I think having the legal services necessary for people to also utilize our rental escrow system as a support in this is lacking. But I'd like to hear from others on this. I know, even from the environmental inspection side, we've got to build that side to compel the actions. And as I said, MDE needs the resources to expand with the work that's going to happen, because MDE and the Baltimore City Health Department largely, but not solely, are going to get hit with the unintended consequences of these investments that are going to get made. And I worry that they're prepared in a business-like manner. Not that they're not prepared intellectually, but work-wise, people, human beings showing up to the job, and the ability for them to outsource if need be, help to build a stronger private market for this. So I would say to our other agencies as well, what do you need? Or Barbara, what do you need? And Angela, what do you need? And if there are people from the public here, I would like to hear about that. Maybe you need nothing. I don't know. Or you don't know.
Well, in Washington, we've just noticed that, our numbers have increased dramatically. So that's definitely an issue, and trying to get kids in quick enough with my limited schedule. But then the follow-up has been really difficult. Finding lead-free housing. Families are on lists for a long time, and they keep getting hit with going out to see a house and find out, no, it's not lead-free, even though they had a lead-free certificate, or the landlords, whatever you want to call them, collecting application fees from, say, 10 people. And who knows, the parents, like, I can't keep spending application fees to not know if I'm going to get a house or not. And a year and a half later, still don't have the house or a place to live. And then in the outlying communities.
Pause on that for just a minute.
Okay.
Right. And I mean, for Theo and Jack and others who are in the housing field, and I don't know if Adam has been able to join us yet, right? Clearly, there's got to be a better way for especially our very low income residents here. If there's a way to universally clear people so that they're not going unit by unit by unit on what is necessary on either credit checks or background checks or whatever, we've got to figure out a universal way so that people are approved at a certain level, that they're not getting hit with a fee. And is this something that would be practical that government could do, or that we establish some sort of way of certification? If people can follow me on what I'm thinking, but this is an issue. We talk to families all the time that are paying $200, $300, $400 in application fees, and that's what they were paying in rent. And we just need some better advocacy or better solutions. I saw Julie, you came on. I don't know if you want to say something on this, or anyone else. Yep, your hand is up. So I guess you did. There you go.
You can finish.
Can you introduce yourself, please?
Yeah, absolutely. Hi, everyone. My name is Julie DiGirolamo. I am the new lead director with the Baltimore City Health Department. Very excited to be here.
Very excited to have you. Welcome, Julie.
Thank you. This is my first lead commission meeting. And I will also start with, I am very new to lead. I am learning a lot. So please tell me if this idea would not work at all. But just listening to the problem that you just identified, I'm wondering if there's a way that we can incentivize landlords of having a list of homes that have their lead inspection, have been passed, and maybe listing them on a website so that families don't have to be going through applying to multiple different places and then still dealing with the problem of not knowing if they're lead free. That was just a thought that came to mind. I would love
let me pause on that, and we're going to get to Tyler on this as well.
Sure.
In just a second. First of all, welcome on behalf of the commission.
Thank you.
We hope that you will lean in hard with us as we do this, and I super encourage a new generation of joint cooperation between the health department and the housing department at the city, so that the housing department can really get its dollars out the door and work with the health department on the human being side of this, right? Mm-hmm. As well as the inspection side. But Nicole, in the past, HUD required that we kept and maintained a lead registry. So back when, I only know this from when nonprofits were able to receive lead money and we ran lead programs, right? There were HUD programs. We published a list of lead housing that had met the standard for the grants and that were available. Are there efforts, for example, in that program, or Theo and Jack at the state, where we're encouraging owners to let us know their inventory, how we get this coordination of placement? But does HUD require that anymore in their grants to you, for example, Nicole?
I would need to defer to Kat to actually answer that question.
Oh,
But
she got on the line. I didn't see her. Okay, sorry, Catherine.
she's actually running late. But what I will say is,
No, she's here. She's here.
oh, okay. All right, well, go ahead. I'll let her answer first before I come back.
So Catherine, do you know about that question? And Tyler, I'll come right back to you.
My hand is raised for Nicole.
Oh, okay. And then Nicole can say what she wants to say in a second or more. But Catherine, are you here? It shows her, but okay, maybe she's not. But let's get that answer for sure. But I do think there ought to be a registry put together. That at one point in time, we had asked the state to be able to identify on the State Department of Assessment and Taxation a way to identify housing if it had gone through risk reduction measures, if it met the state standard. But I do think we're going to need the help from the Maryland Multifamily Housing, from Property Owners Association of Baltimore, which I haven't seen in a while. But, I don't know, and I don't think Jacob is here today, but if there are any property owners on the line, I do think we need to think about how do we build that list.
So Ruth Ann, on the city side, we do have our portal where houses are supposed to be licensed and registered. And to be licensed and registered, they have to have that lead inspection. So on our city website, you're able to put in an address to see if that particular unit is licensed and registered. I will let people know that they are two different things. So you will find that some houses just say that it's registered. That doesn't mean that they have a license. And so it just means that they did the initial piece, but they didn't get the inspection. So those are two totally different things. When we do relocation, in terms of moving someone to a different house, they have to have that license and registration. We are moving to a new system, so hopefully we would be able to do some sort of data pull, just to pull out if a landlord has 10 properties and they're all licensed and registered. But I can find out that information. But what I wanted to offer to the previous conversation in reference to relocation, what I'm finding in the city post-COVID is that a lot of these families have evictions on their record because of, COVID-related circumstances. So getting them into a new unit has sometimes been very taxing, even when they're getting government assistance. A lot of these landlords still want them to pass a credit check and still want them to jump over some other hoops. And this is even in cases where the city has committed to maybe doing a double security deposit. And that's really a thing now. Landlords, if the person does have an eviction, they're asking for double security deposits and just a ridiculous amount of money for a family to move in. And so this is what we're finding, not just particularly in lead cases, but just across the board, getting people housed. And so I don't know if it would just be a fund or some sort of fund to be able to financially assist in that. But there definitely needs to be some additional regulation because, there are all these barriers being put into place to rehouse people who may have found themselves homeless or evicted due to COVID circumstances and have an outstanding balance. And a lot of them are also taking them to court for those outstanding balances. We partner with all of the nonprofit legal partners to be able to get them counseling. So just as a note, if someone is in a house that it does not have a Baltimore City license, that landlord is not allowed to charge rent. So that is allowing families to be relieved of that money if they actually go to court and that landlord does not have that license. But those that do, it's really presenting a problem.
Well, Tyler's not going to like me for this, but MD's got money that they can put out to RFP on enhancing those legal services, case management services, and I think can be targeted around this. So there's another encouragement to put that out to bid.
Not mad at you about it. We're about there.
Okay, because it's needed. But I do think, Nicole, this is something And I think Jake Day and Alice Kennedy should be, maybe brought into this kind of resolution discussion on the issue of double security deposits and application fees, right? And how we can get over what's happening because people, right during COVID, either didn't connect to their rental assistance resources or whatever, right? But I think this is a perfect place for the United Way, the Baltimore Community Foundation, the Able Foundation. Actually, I think could put together sort of a guarantee fund around that. On the double security deposit potentially. I mean, as an idea that we ought to talk to them about. And then we ought to create a way, I think to uniformly get people qualified that owners sign off on, at least, and try to get them to accept sort of a common clearance on what they need for people on applications. And I think, somewhere like a city can weigh in way more on that. But I think standards around this or incentives in the grant programs or others need to be there because these are very real things, right? If we get people housed in lead-safe housing, lead-free housing preferably, we start to minimize the impact here. But Barbara, you have your hand up.
Nicole, I was just wondering, one, can you share the link? Because I know last time we were trying to determine if a location was safe or not, if they were registered and licensed, whatever link we have wasn't working. And does it note if it's lead-free versus lead-safe?
I would have to double check with Deputy Commissioner Jason Hustler to see actually what is on the document that they accept before they give them that license, so I can get that information for you. But I will put the link to it in the chat.
That would be great. Thank you.
Yeah, I think, Nicole, having Jason come and maybe talk about, maybe we can put a panel of legal services too, how we're thinking about solutions here. But if we need a bill in the State House this year, we're going to have to move quickly. If any of this can be legislated around the double security deposits or others. And we may not be able to, I don't know what the law is on that in terms of being able to dictate to the marketplace. But it does feel unnecessarily discriminatory to get people housed. If units are receiving state dollars, federal dollars to repair lead, and then, so I do think there is a bit of a power in the mutual service agreement that the state, the city, federal programs can put out and say to the owner who receives money to de-lead their property that the practice of a double security deposit can't happen, for example. I think you do actually have the power to do that. Theo?
So I think there will be some discussion in this space in the upcoming legislative session. So be on the lookout for that. That said, there was a specific question around the state having a role in terms of creating a unified application portal. That's something that's not currently under discussion. That said, MCOG recently did put in an application with HUD through the Pro Housing Grant to create such a portal in the DMV area. So now I don't know from my discussions with them, I don't remember if they mentioned it would have like a single application fee or if there would be multiple application fees, but this is something that San Francisco did in their area through a program called Balloon Housing, that they have one unified portal for affordable housing, and I think probably some non-affordable housing as well for that region. The grant they applied for, Pro Housing, the department also applied for. It's a very competitive grant, so we'll see if they get funded for that. But they did request about $1.1 million to develop that for the DMV region.
That's amazing. And are you partnering with Pro Housing or you're competing against each other?
We're mutually supporting one another's application. That's how I put it. Whoever gets it, it's good for the region.
And it's going to HUD, is that right?
Yep. It was an application was beginning of November, I believe, or December. I don't know. Time runs together. So we should be hearing back soon.
Thea, will the 1.1 million be enough to get that done?
I mean, that's what they put in for the grant. I can't speak to how they came up with that. But you know, that is what they put in the grant.
Okay. And I was just wondering if it's happening in San Francisco. If we don't get the grant, can't we just find a way to replicate that, at least from a state standpoint?
Yeah, I'm not sure.
Yep. Okay. Other comments here? I'd love to hear from others as well. Yes, Angela.
Good morning, Ruth, and Happy New Year to everyone.
Happy New Year.
This is in reference, I'm seeing this as a needs survey, beginning of the year, what we want to do the entire year, and then to see what we have accomplished end of the year. I'm bringing back the need for funding for childcare programs, for free water testing, and also the mitigation support. Public school systems have this, and public school system have resource. If they find elevated lead in the fixtures, connections, they are able to fix it, but childcare providers do not have that opportunity or money to do it. If you are putting back on the childcare providers, they are going to increase the fee for the parents. That will negatively impact enrollment into the childcare program and their growth and development and early learning. So it has its own domino effect. And I've been requesting our commission to kindly look into this. If something we could do, at least to start with family childcare programs in the counties that had a high number of children with elevated lead level, at least start with smaller numbers and few counties as a pilot program, and to see how this is helping the families and also the early learning of the children. That's the first request. And the second one is more coordination between the local health department and the childcare programs, especially when they identify children with elevated lead level. Last year, we did get few children with elevated lead level. Our childcare staff, they are reviewing the records and they immediately contact me, hey, this child has elevated lead level, what should we do? So then we contact the parent and then we contact the healthcare provider and see whether the child has been managed. And then we get the note from the healthcare provider that the child has been managed. So I know local departments, only very few local departments have led case management, and also the community health workers, funding to health departments, and to have community health workers in each health department and providing outreach to childcare programs in their region. That will be a great help to the programs, because that child came from the childcare program. Not necessarily that was the lead was identified as the primary source in the childcare program, but the child is attending there, and that opens the opportunity for the health department to come and inspect the childcare program. So more coordination between the health department and the childcare programs would be really helpful, that we could start for all 24 regions.
Can I ask a simple question?
Yes.
Is it something that is one of the first tools for when your childcare centers have a child with an elevated lead level, that they are also almost automatically pushed over to the grant programs that exist at the state and the city to make sure that we not only doing the environmental investigation, certainly we are at a 3.5 action level for sure in the state, but that it's getting into the programs necessary to do the mitigation, the exposure control, And is that top of the list in a child is reporting? Because I like we have heard from two people today, right? You and Barbara, something that should not go without the primary notice here. We are seeing elevations of lead levels in our practice. Now, I don't know how it's showing up on the data side. We'll need to see the 22 report soon and others. And we need some more real-time data from, I think, MDE to this commission, even if it can be quarterly, just trends of what we're seeing. But we are seeing a spike in lead levels or reported lead levels. And if that is right, showing out in your practices, we have to have a much better preventive focus triage plan in all of this to address that. How shameful that will be if we have been sitting on our laurels of success, right? And then we now have another generation where we're going to spike lead levels. So we got to look at all of what we're doing, all of us, and say where does that fix need to come? So we're going in the other direction, driving down the lead levels. But we have money in systems right now that need to get to people. And let's get that. My own organization is sitting with money for, if you refer to us, we will go get that house done. But we need to get these houses moving. We also need this commission thinking about, and especially DHCD and labor, we need the referrals on contractors, right? We need to get these connected. There is enormous opportunity at community. But we've got to be making sure we're looking to invest with in the communities. Who are the contractors there? That we have to take that equity investment. There's opportunities to tie this together, right? Also, Mangela, the city of Baltimore now is spending, I want to say $140 million, something like that, where they're offering lead line replacements for residences through DPW. And Julie, maybe this will be a way for you to get to know DPW, but could I ask you to see if you can contact them and see if DPW itself will present on exactly what the money will pay for on lead line replacements and whether or not that will include childcare or fixtures and how that can happen. I'm not an expert on that program. I know we are starting to incorporate the scratch test on the pipes into our work when we're in homes so that we can make referrals to DPW. But there is money there, and it's significant money. The mayor has put significant money through ARPA. We need one thing I will help the department do is an asset analysis of what county commissioners have put into play here, right? Did anybody have their hand up? Barbara Moore.
Sorry, I have a few more things.
Hang on, Mangela, were you done on yours?
There is one more. Sorry, there is one more that needs the COMA changed for the lead-free certificate, because childcare program, if anyone opening the childcare program would have to submit the lead-free certificate. But the current COMA states that it's only applicable for residential rental property conducted before 1978, but it does not apply to owner-occupied facility. So what we are really like going through the back doors, asking them, hey, it is the, though MDE does not require for residential property, but since you're going to have the childcare business in your home, we would want your your house to be inspected.
Is that something that that MS DE is going to propose, or is it something that you need to have some champion in the legislature to propose?
We have been talking with Paula for quite some time. But since if MDE does not change the regulation, we cannot adopt it. We always look into parent organization for such as MDE and the MDH. And so we would just like adopt what their regulation is and say like, according to MDE or so and so, you would have to do this. So what we are doing, calling when the lead inspectors call us, we tell them, hey, use the taxation, the property assessment and taxation number to provide it to MDE to produce the certificate. And it's a lot of explanation need to be done. And the MDE say, oh, we cannot really produce the number for you to issue the lead-free certificate. However, you can complete the test and provide them the lead result that I have to translate and read through it and understand and let them know that it is free or it needs the abatement services. So it's a bigger issue, but we have been talking about this for quite some time. Since you asked us like what we need for.
Well, can I just say and jump in here and ask that MDE and MSDE please meet in the interim and be able to report back to the commission any progress on this or reasons why or why not we wouldn't do this unless you know now. Just because it sounds like it just needs to get some attention to resolve one way or the other. And then if it can't get resolved by regulation, it will need statutory issues. And then we're going to run into a short window to try to get that in, but we can do that.
Definitely happy to talk about it. Yep. I'll send you an email, Angela.
Okay. So
Thank you.
Tyler, you guys will just at top of chops next month be able to report back on what that means. Certainly. Okay. Any other folks who want to contribute on this? Yes, Barbara. Sorry, I forgot.
That's okay. One is to consider some kind of criteria for actually doing homes for children, inspecting homes for a child that it has already had their 6th birthday and forward. Whether maybe not all children, but if there's some other contributing factor, to consider that. We recently just had a case, a referral for a child that was 12 who has intermittently had elevated lead levels. To me, it looks like it's been consistently elevated for at least the last 6 years. And the mother reporting nobody's ever done anything before. So why are we worrying about this now?
Can I just pause on that and also say, increasingly the studies are showing the impact on cardiac health and hypertension from lead exposure, right? And for adolescents, teenagers, and adults, right? And building that. And I will say, I get the neurodevelopment side is why we've had such focus on 6 and under, and it should be there. But the Journal of Medicine's report about the number of deaths that are related directly to lead, the cardiac deaths related directly to lead in 2019 alone was stunning. And I think we talked about that in the last commission or the commission before, but I do think there has to be a relook at this because all of us are at risk for impact. And Ellen Silbergel's study that showed an 8-to-1 increase in hypertension for adults exposed to lead. In the Black community where there has been such high rates of hypertension, in the brown communities and even in the white communities, right? We blame it a lot on diet, and I'm sure that is the major contributor. What I think doesn't get looked at is this issue of lead in the hypertension issues that ought to be looked at, and how these policies have contributed that. Yes, Cliff.
Okay. resources and cleaning, specific cleaning supplies for the outlying counties. We've run into issues, as you probably know, with COVID. I was able to do a lot more virtual visits and have children on the Eastern Shore and Western Maryland. And Allegheny County, she has 5 hours a week to dedicate to lead and no cleaning supplies. So available to give to families, whereas some of our more local counties have those supplies available. So I don't know if that could be a grant for them. Immunet, I've just heard from 2 primary care providers are not showing lead levels. So I don't know if Cliff, that's something you all can handle on your end. And looking, you mentioned about trends of the elevated blood lead level. Fred Banks and I have been looking at trying to get a report available so it doesn't just say levels greater than 20, but actually break down more of 20 to 30, 30 to 40, or 45, 45 to 60, 60 to 75, those kind of ranges, so we can see how significant the incidence of the higher levels have been over the last, say, 5 years even. And that's it.
No, those
So,
are
Ruth Ann?
important. Yep, Cliff.
Oh, so a couple of things, Barbara. Thank you for those. Number one, as you know, the Medicaid CHIP, at least for the Medicaid CHIP program, we can provide services to children as long as they are under the age of 19. So lead abatement across the state, at least for kids who are involved in our Medicaid CHIP program, the only stipulation is that they be children under the age of 19, and they can receive lead abatement services if they qualify by virtue of enrollment in or eligibility for CHIP and a blood lead level that is at the blood lead reference value. That's for your first point. For your second point on cleaning supplies.
Sorry, Cliff, I have a question.
Yeah.
How do we get the initial inspection done for that?
Well, there will be, if they do a referral to the program, to the Medicaid through the local health department to DHCD. DHCD conducts, I don't want to speak for Jack here, and he's on, but DHCD does an inspection anyway as part of the evaluation of whether or not there's lead paint to be abated in the home.
Right,
and
but
that
it's
is
primarily, owner-occupied homes? Because
owner-occupied.
Right. What about all those rental units that are out there that have children that are over the age of 6?
Right.
And,
We don't, if
right.
it's a commercial rental, that's a different issue.
Yep.
But at least for the owner occupied, we can do that up through the age of 18 and above, as long as they're under the age of 19.
Right.
For cleaning supplies, thanks to the Association of State and Territorial Health Officials, we've actually made grants to all of the local health departments that are not funded under the home visiting program under Medicaid CHIP. And so they can use those dollars to purchase cleaning supplies, as well as support staff efforts for case management. And we may be getting some additional funding for that for this year only, but that at least would allow them to purchase cleaning supplies across the state if they needed them. I think that those were the 2 points that I thought we could talk about. And Immunet. Shamola and Dr. Boss Victoria can discuss this, but as far as I know, they are still sending data to the Department of Health, and that is still going into Immunet. So if that's not happening, we need to know that, and I can work with MDE on making sure that the Immunet lead data is up to date.
Okay. I'll try to pull up a few of my patients, which I know definitely would have had lead levels, and I'll look in Immunet and see if they're there and let you know.
Yep.
So I know, Anna, you may still be on the phone here. And one of the things I'd like us to work on is getting the voices of parents. And I'm going to say this to everybody who's giving grants or in the health departments or working with families. Well, we're having a good conversation here. I think it's important things, right? But I'm going to try to work with MDE and either next month or March, really put together an invitation to community, to hear from community across the state, to hear from parents across the state, because as we think about the things that need to get done, we've got to hear directly. This commission needs to hear directly. So we will put some effort on that. I know Chevelle is on the line. I'm going to ask her directly in our work to do a strong outreach to get attendance at the upcoming commission and for us to be able to hear too from the other side of this, what do parents need. Barbara, I think you've been an incredible advocate today on the application fees, the deposits. Appreciate the work the state's doing on that. But as much as we care for, work with parents, we'll never be them, and we need to hear from them directly. So I definitely also think as we move this work forward, I will do my level best, as long as I'm in this role, to double down on getting the voice of parents. So I'm going to just renew that we have a couple of parents we're talking to about being on the commission. We still need to fill a number of other roles on the commission. So I definitely want to make an effort to get those filled. I told Secretary Edwards I want to try to get them filled by the end of the first quarter so that we're hearing from the right voices across the board. So any other comments on technical resources, on funding, on obstacles and barriers? I think this has been a very fruitful conversation, and I just invite if there's any more comments that we want to make before we move on to the next section of whatever we have left on the agenda for this one. Going once, twice. Okay, Wendy, can you put up the agenda again? And thank you. We will record these back. So Anna, I know you're on. I don't know that Adam has made it, but I wanted to, I think Theo's mentioned there might be some things coming up. Tyler, I think there may be potentially some legislation that you're not ready to talk about coming out of MDE, potentially. So I do want those who would like to be on a legislative subcommittee that week as these issues come up, if they do, would be willing to weigh in. If you could just raise your hand in the chat to say you would like to be on that committee. We really need people, so I'll compel you to say yes. And Anna, you're on the phone, so I'm going to count you in unless you say otherwise.
Yeah, you can count me in.
Great. Theo, great. We'll have you to look at that too. And if we could get anyone else on that. Barbara, would you be willing to? Tyler, yes, of course. Agencies, but Barbara, given...
I can't commit to it this year. Sorry.
Okay, got it. Understand. Paul, possible? There you go. Paul Rogers, thank you. All right, and I'm going to reach out to Jacob and Adam because we certainly want to have the property owner voice in this as well. So we'll reach out to the associations there to do that. So we have, and we will try to get the folks who haven't been there. And just really quick, Nicole, what's your balance on dollars? Or Catherine, what's your balance on dollars that you still have need to spend? Approximately, do you know?
Approximately 3 million.
3 million. So we want to make them super. Catherine's like a rock star getting that out. Then we have several million in ARPA dollars. So we estimate in the Baltimore market, there is about $13 million that can be lead actively available. I can go through that with our partners where we see that coming from different sources. So please, again, for families, we will look at the resources in other parts of the state. Theo, what is in the state budget to for the match on the Healthy Kids program? Do you know? Or does
I
Cliff know?
think I'll have to defer to Jack on that specific question. Sorry.
Okay.
Yeah, we roughly still have, we have about 5 or 6 deals that are being tabulated to go over to the committee for final approval, but we still have roughly $2 million available for the Healthy Homes for Healthy Kids.
What's in the state budget proposal going into the legislature to sustain and maintain that?
So our it's one of our programs that is paid through our capital allocation. So our budget traditionally is about 8.4 that could be spread across all of our programs. We traditionally do about $1 million in that piece towards lead, and then critical repairs covers the rest of it. I do know that the budget that did have a request above the CIP for an additional $7 million, but we have not heard back from them if that proposal has gone to the governor and has been sort of approved to go in front of the House and the Senate during the budget hearing. So we're still waiting on that.
And that 7 million is all to match for lead, or
no?
Okay.
It is to increase our critical repairs program. Obviously, with the increase influx of funding through our energy, it's mainly the main idea is for it to be in the leveraging for the whole home model, where we're addressing deferrals in the energy world for critical repairs, but one of those critical repairs is lead. So so a portion of that 7 million will go towards lead, but the thought process through our housing plan is majority of it will be going to the other critical repairs, so that we can leverage more funds to do complete some of the repairs that need to be done on those deferred energy cases.
Great. Okay. Well, that's something we'll want to take up as part of the legislative support for that, for whatever MDE may or may not have, to make sure we get the resources in the right place. I went off camera just because I'm getting notices that my internet is unstable. And apologize for been breaking up at all on that. Okay, and thank you. So let's get to the hot list, Wendy, and we'll go through and we'll do a little speed dating here. And I, again, I'm looking at the list of attendees. I know it's the beginning of the year, but I'm going to ask every single person on this commission to take as a real obligation where we can. I want to get the public involved. Please outreach. If you're giving presentations, you're talking to people, talking to community organizations that may have an interest in this topic. Let's get them there. We'll try to get places like the Public Justice Center and others here for sure. MDE, anything we've left on the table, Tyler?
The only thing that we have not talked about yet, just want to remind everyone that we do have federal funding for lead service line replacements. I believe that was to the tune of about $50 million for the last 2 years, and some of that money is available for the surveys themselves. So really working on trying to develop that inventory of lead service lines, so we know where they are and where to address them. You had mentioned the climate plan. Part of that are these energy retrofits, and so the dust and other disturbances that are created from those are top of mind. And look forward to working with you on further plan to address that. And then lastly, it was kind of touched on, but just want to put it out there even more. The new lower blood lead reference value has started. I guess our action level in Maryland is now down at 3.5. So we will be conducting environmental investigation based on 3.5 number rather than the 5.0 number. And we are going to start that even with those cases that were coming through in December. So we expect to see, maybe 2 to 3 times the amount of environmental investigations, maybe even more. So, working on program efficiencies and resources where we can.
Got to understand, and that is good. And I, in my discussion, just so the agencies are aware, I know Delegate Lewis is going to request that there be a briefing on lead to both the environment and the health government operations. Kind of just heads up to you, Tyler, Cliff, Theo.
Thank you.
I think that is really important. Baltimore City has the trolley tour. So I saw a note here. What are we seeing? Yes, I think that's right. Be wonderful to get those connections. Chevelle, please, if you want to reach out to Chevelle, I know we do the trolley tour as well, and I think we need to get more and new ways to reach out. So thank you, Talia. All right, Cliff, anything else on your list there?
So I suppose some of you have probably heard about applesauce. So I just want to take a moment to just say we are obviously continuing to work with MDE very closely on all issues related to lead and the implementation of the new 3.5. Somebody that you haven't met yet is Dr. Lori Tantlinger. She's on the phone. She's our new preventive medicine resident from Johns Hopkins, and she's going to be working with me and the folks at MDE as we think about outreach to providers to, now that the environmental inspections piece is solidified and in statute, we want to think a little bit about additional outreach to providers on how to approach kids with lower lead levels as they are notified about kids with levels of 3.5 to 5. So Dr. Tantlinger will be working with me, Dr. Boss Victoria, Fred, Shamola, et cetera, on how to do that outreach and maybe some additional materials, which we'll also work with GHHI on. In addition, on the applesauce front, Fred and I have been talking about how we are going. CDC is making an effort to do some backtracking to figure out how many kids actually were affected by this. The reason that that's important, because there's been a lot of information out, and we hope that most of this product is off the shelves and off of people's individual shelves, but it is shelf stable. And we do want to make sure that A, we continue to remind people about the presence of this product. B, that we look at how many children were actually affected, because it has implications for the next time that this occurs. And the FDA is also looking at potential criminal activity involved in the supply chain and potentially intentional addition of this material of lead to the product. And 3, it is a reminder that as we look at other sources of lead other than lead paint, we don't want to take our eyes off of lead paint, but we do want to make sure that as we go into homes in children with lower lead levels, where there's the potential for multiple sources of exposure, multiple pathways of exposure, that's a very important message for the parents and for providers to think about as they assess those lower lead level exposures.
Yeah, it's going to require a comprehensive look for sure.
Correct.
I appreciate that. And Cliff, I have one question that we get from parents a lot.
Yep.
Is there a way for people to test things like the cinnamon they have in their own home given this?
The testing for adulteration for lead in food is complex. It really requires a commercial laboratory that's familiar with it. There's no home testing that's available that would be of any value. So it really does require that they send the specimen to a commercial laboratory, and it's not cheap.
Okay. I think that, Barbara,
Cliff, do you know if a blast email or anything went out to all the primary care providers? Because
Yes.
I've spoken to a couple and they're like, oh, really? And I thought I received something.
You
And
did.
Okay.
I sent out a clinician letter as soon as it happened.
Okay. I thought
Yeah.
so.
Yep.
Okay.
Yeah.
Thanks.
But that's why, the throwing spaghetti against the wall is my preferred approach, as long as the spaghetti is not adulterated. Sorry, Tyler.
I always appreciate the jokes.
Okay, let's go to M8. Paul, anything from the AAP?
Yeah, no new information.
Okay. Mangela, anything else from you?
No, ma'am.
Okay. Benita?
No, thank you.
Okay. And Theo?
Only update is we're still waiting to hear back from HUD on the Healthy Homes Production Grant Program. So just like many HUD applications, still waiting on them for a response.
So you applied for that? Could you potentially okay, that's great. That and then I guess we'll gear up to try to get the state and the lead grant later this year, right?
Yep, sounds good.
Was there a debrief, Jack, with HUD on the lead grant?
Not yet. So it has been scheduled, and we're trying to get that coordinated. They had some conflict issues, so we're trying to hear back so that we can be advised on where our initial proposal lacks, so that we can make sure that next one available we ace it.
Okay, great. Thank you for that, and we'll wish you the best of luck. When did you put in the Healthy Homes production? It was in December?
November 7th.
November 7th. Okay, good. We'll be cheerleading that along. I do encourage the state to make sure that Senator Van Hollen and Senator Cardin's office know, so they can weigh in as need be. Nicole, Catherine, anything else? Nicole, thank you again for being that stalwart to show up and be in person. Wish I could have given you a hug for New Year's, so
Thank you so much. I'll defer to Catherine first to see if she has any updates.
No, I have no updates.
Okay.
And I don't have anything different to offer other than what I offered last month, as far as we do have ARPA money to spend down. So we are in a position to look at cases comprehensively. So if you have referrals, we are open to them so that we can get this ARPA money spent.
Hear, hear. Julie, what are you, day 20 or so on the job or something like that?
Yes. Yes. No other updates for me. Thank you.
Well, is there anything we can do to help you?
I don't know just yet. Yeah, I'm still learning.
And Julie, where did you come from? Did you say at the top of this where you came from prior to this job?
No, I actually just came here from the Texas Department of State Health Services. So I was their state child health coordinator. So I worked on planning all of their public health programs related to child health.
Wow. Well, you're going to have a great friend in Cliff Mitchell and so many of us here. And Maryland is a much better place to be. So welcome to Maryland.
Thanks. Yeah. I've
We-
been in Maryland before. Before I worked with Texas, I worked at the University of Maryland in Baltimore. So I'm very happy to be back in Baltimore. And yeah, I'm excited to be here and learn from all of you too.
welcome home.
Thank you.
Hey, Chevelle, do you have anything that you want to update for us?
No, I don't have any updates.
Okay.
Thank you.
All right. Well, let's make sure we do that. I think I gave a lot of updates on GHHI at the top. I'm going to leave it at that, except for to say, like Nicole, and we are all partners in this. we're all looking to get as many families into the system to get these dollars spent and ensure they get spent. There's no guarantee on any, certainly extensions on certainly ARPA dollars. We don't know where Congress will take that in coming years, so let's get that done. Is there any other comments from the commissioners? Any comments from members of the public? Okay. All right. So we will meet next on the 1st of February. We'll do a review of the annual report with Paula and Wendy et al. We will update commission calendar. I would like to bring to that I really would like to have a public meeting in either June or October to focus on lead, either through Healthy Homes Month or through the Lead Week, and be planning that now that we are getting good input. Sooner the better, as far as I am concerned, and to work with all of the agencies in the governor's office and the public on that. We do need help on commission. We have a number of commission slots that are not filled. So Tyler, if you and I could talk about that and just get a plan, but we're encouraging people to make referrals as you see them in your work. And we'll have a presentation coming up from FDA or EDF on those related to products. We will look at the strategic plan on lead. Theo, it has you there. I don't know, does DHCD have a particular strategic plan on lead?
I think this is referring to our housing strategic plan, which has
Okay.
a plan on lead. Jack, please correct me if I got that wrong, but.
Well, I believe that that is correct, and what we'll do is for the next meeting, talk about our housing plan and then how lead interjects into that housing plan.
And I've asked a member of my staff to do the greenhouse gas presentation on lead, so it'll probably be Cynthia Herrera Scott, not Herrera Scott, sorry, Herrera. She's not Laura, and Michael McKnight to look at that so that we're a little bit more clear on why we have these concerns. And ensuring people know that. And if there is legislation put in, we will be looking at that. We will tap the committee. I'll probably call to have a meeting anyhow and be looking at that work. If we have nothing else, Wendy, is that the end of that? I want to thank everybody for their time today. I thought we had a good discussion. We'll try to see how we can put those in action. And most of all, stay safe. Please take care of yourself while we're having all these bugs fly around. We need everybody at full tilt. So thank you and Happy New Year to everyone. Thank you.
Happy New Year, all.
Thank you. Happy New Year.
Happy New Year.